Hello, I'm Dr. Mark Richards, answering your questions at nobodywantsyouhealthy.com. So Steve, what question do we have today?
Well, I tell you, we've got Frank from Los Angeles, a married guy, happily married, he says, but he and his wife's sex life has really seemed to diminish over the years, although they report that they're both happily married and et cetera, and want to know what they could do, hopefully, to put the spark back in their sex life. And so they are reaching out to you, Dr. Richards. What can we do for Frank and company?
Well, Frank, I hear this question in my office, and sex is a complicated issue because sex involves psychology, it involves relationships, it involves stresses, medications, drinking habits, all sorts of things. But if you and your wife have previously had great sexual health, then the sexual health issue is actually much easier to understand than sex itself. When testosterone gets low, as men and women age in their 40s and 50s, a couple things happen. And if you read my book, you've seen a whole list of things happen that need to be corrected for optimal health. One of those is that you get a reduction in the production of a substance called nitric oxide. Nitric oxide is something that causes your blood vessels to dilate and engorges the erectile tissues, both in men and women, which allows a more augmented and improved sexual response. So certainly, if you both have lower testosterone, that could be a cause. Testosterone also causes a lack of estrogen production when it's low, because all of the estrogen in our cells is made from testosterone inside the cell. So if your wife has a low estrogen production in her vaginal cells, then dryness and pain with sex is obviously going to be a problem for enjoying sex. So there's many aspects to this. Like I said, sexual health is much more easily understandable than the complex subject of sex itself. So I encourage you to read my book and see the appropriate doctor, get the lab tests done. And if you both have low testosterone, I think treatment with testosterone pellet therapy will help you guys both. Thank you for the question, Frank. And text us back or email us back if you have any further ones.